Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wasallam. Assalamu alaikum wa rahmatullahi wa barakatuh. Social media viewers.
Walaikum salam.
Alhamdulillah Azza wa Jal, we are back with our program Health is Wealth. And once again, we've got a very interesting topic to discuss today, and that is topic of back pain. Very common problem, and it can have very extensive effects on the functioning of an individual on their daily life, and it can have obviously impact on our mental health, on our relationships as well, on our job functioning and so forth. Now once again we've got our guest, Dr. Rizwan, who is a consultant in orthopedic surgery. And as you know, that orthopedic doctors are the ones who will obviously who look after our bones and especially our backbone. So we welcome Dr. Rizwan. Dr. Rizwan, Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam wa rahmatullahi wa barakatuh.
And I'm very grateful for your time that you are giving to us. May Allah Azza wa Jal reward you for this. And inshallah Azza wa Jal वक्तन फ़वक्तन थोड़ी बहुत उर्दू में भी गुफ्तगू होती रहेगी. हमारे कुछ नाजरीन जो है वो अगर आपको उर्दू में जवाब चाहिए तो आप कमेंट्स में अपना सवाल उर्दू में लिख दें या ये कह दें कि उर्दू में जवाब दीजिएगा. बसूरत दीगर अदरवाइज इंशाल्लाह विल बी टॉकिंग इन English. So as you can see on our screen, that we've got some slides as well. So inshallah Azza wa Jal, today we will share some images with you as well, so that it helps you understand things much better. So let's go to Dr. Rizwan and ask him that what is the basic function of our backbone, and what structures are there, if you could sort of kindly just enlighten us on this.
So the main function of the spine, our spine, is the stability. Stability is one of the main functions. As you asked about the structures, there are quite a few structures, but the important one or the common one, if as perhaps you can see in this figure, is picture is the vertebrae. So the whole spine, which includes the cervical spine, the thoracic spine, the lumbar spine, and the sacral spine, it is composed of about 33 vertebrae. So vertebra, jisko reed ki haddi kehte hain, that is one thing, and then between the two vertebrae is something called a intervertebral disc, जिसको हम डिस्क भी कहते हैं सादा जुबान में. दो vertebrae के दरमियान intervertebral disc होती है, and the function of the disc is again to provide the stability. One of the function is कि आपके disc जो है ये it is a shock absorber as well, and the disc is composed of material which is a mixture of different chemicals, including the main ingredient, however, is still the water. डिस्क जो है वो आपकी स्पाइन की हाइट को भी जो है वो डिफरेंशिएट करती है. अगर आप किसी बूढ़े शख्स को देखें, if you see an elderly person, the height of the spine, he will be a bit short statured, and one of the reason would be the disc will be they will be quite degenerative and they will not be well hydrated. That is one reason. The other common thing is, which you might have noted yourself, आप लोगों ने खुद भी देखा होगा कि जब आप सुबह सुबह उठ के गाड़ी चलाते हैं, if you once you sit in your car, you might have to adjust the mirror. आपका जो back mirror है उसको आप adjust करते हैं, and the reason is कि जब आप सुबह उठते हैं तो आपकी height दूसरे शाम evening की height से थोड़ी सी ज्यादा होती है, क्योंकि disc जो है they are well hydrated and you are a bit taller than in your height in the evening. So that
this is an interesting fact. Is that why sometimes I've seen, obviously, when people go for height test, these world records, so they measure their height on different times, morning and evening. That's probably the reason.
Yeah, that's a very well established reason, that your height in the morning will be higher. It will be a bit more than, there won't be a huge difference, but there will be a subtle difference anyway. So that is one reason in the anatomy. So I've mentioned about vertebrae, discs, and the other not most important, but very important thing is the the spinal nerve roots, which basically emerge from the spinal cord. जो हराम मगज जिसको हम कहते हैं, रीढ़ की हड्डी के अंदर होता है, वो आपका that is a connection between your brain and the peripheral nerves, वो spinal cord उसको कहते हैं. कॉर्ड से जो है नर्व रूट्स निकलती हैं, और अगर डिस्क प्रोलैप्स हो जाए, डिस्क अपनी जगह से हिल जाए, तो वो उन नर्व रूट्स को प्रेस करती है, और जिसकी वजह से आप कई दफा टांगों में दर्द महसूस करते हैं, जिसमें sciatica is one of them. Or the most, perhaps the most important one is something called a quada equina. I will come to that in a minute. It's a very, very hot topic, and one of the things which I think perhaps if you probably take one single thing from this talk is the quada equina syndrome. So we'll come to that in a minute, inshallah. और मैं वो भी आपको explain करूंगा. Functioning की जहाँ तक बात आई, जी जी.
आपने you've described it, obviously the structure and the function, and how our backbone is extremely important to us. So clearly, that's as a sort of introduction to the topic. Our main focus is obviously on back pain. So if you would like to explain slightly that, or explain in brief detail, that how do we actually develop back pain? What are the mechanisms when people suffer from back pain, so that we have a better understanding in terms of prevention as well?
The first important thing to know is that about 70 to 80% of the people will experience back pain in their lifetime. उनको कभी ना कभी जो है ना वो बैक पेन जरूर होती है, to either to a larger or a smaller extent. The reason for the back pain, the most common one in the adults, is the musculoskeletal, which is basically because of the bad posture, or if you're lifting some heavy objects in a position which you shouldn't be. That is one of the most common one. And you would be surprised to know that back pain, perhaps not surprised to know, but disability, one of the top five disabilities in the world, which back pain is one of those five. So that is something which you need to be aware of. So kamar dard jo hai, back pain is again the cause to some extent depends on the age as well. अगर एक बच्चे में बैक पेन है, अगर एक adult में है, और एक elderly में है, the causes are different. In elderly, बूढ़े लोगों में 50 plus में, the cause is usually degenerative. अगर एक बच्चे में है, again the thing is different. I will come to them too in a minute, because elderly and children, they share a couple of things. लेकिन by and large जो adults में back pain है वो musculoskeletal है, because of bad posture. And if someone gets back pain along with the leg pain, which we normally call sciatica, that is usually because of the nerve root entrapment. उनमें उनकी disc prolapse हुई होती है. Again, that is because of bad posture and lifting objects, heavy objects. And one of their feature is sneezing, कि जब वो खांसते हैं, छींकते हैं, खांसते हैं, वो दर्द होती है. That is typical of nerve root irritation. तो जहां तक
थोड़ा सा अगर उर्दू में भी इसकी अगर थोड़ी वजाहत हो जाए कि जो है ना बैक पेन के जो मेन कॉजेज हैं उस हवाले से.
जी, यंग अडल्ट्स में जैसे मैंने जिक्र किया, पोस्चर, अगर पोस्चर आप सही तरह, अगर आपका काम ऐसा है जिसमें आप सारा दिन बैठते हैं और आपका बैठने का तरीका ठीक नहीं है, और या अगर आप कंप्यूटर पर भी बैठते हैं, आपकी चेयर, आपकी पोजीशनिंग ठीक नहीं है, या आप ड्राइविंग करते हैं, इन सब में अगर आपकी पोजीशन ठीक नहीं है बैठने की, आप प्रॉपर एप्रोप्रिएट मेजर्स नहीं लेते, then you will probably most likely you will get a back pain. ये तो हो गया adults में. Then this is on the people who have a sedentary life habits, जो कि desk और chair पे बैठते हैं. जो लोग मैनुअल जॉब करते हैं, हैविंग लिफ्टिंग करते हैं, उसमें उनको दे नीड टू बी अवेयर ऑफ देयर लिमिटेशन, के वो जो वजन उठा रहे हैं वो क्या चीज है, कितना हैवी है. उसमें जो मैनुअल हैंडलिंग की ट्रेनिंग उनकी होनी चाहिए, उनको कम से कम पता होना चाहिए कि किस तरह से वजन उठाएं तो उनकी कमर पे जो है वो बोझ ज्यादा नहीं आएगा. ये तो कॉमन है अडल्ट्स का. इसमें कुछ एक दो पिक्चर्स भी हैं, चंद एक वो मैं आपको दिखाऊंगा. एक बड़ी इंपॉर्टेंट स्टडी जो है, जो कि 1975 में हुई, और देन दे रिपीटेड द रिसर्च इन 1919, उसको दोबारा उन्होंने 1999 में दोबारा वो उसको रिसर्च किया एंड दे फाउंड द सिमिलर डिफरेंस। वो ये है कि इंट्रा डिस्कल प्रेशर, जो रीढ़ की हड्डी के जो दो मोहरे हैं उनके बीच में जो डिस्क होती है, वो जो प्रेशर है वो सबसे ज्यादा किस वक्त होता है। और वो अब स्लाइडें आएंगी तो मैं आपको दिखाऊंगा उसमें कि उसमें मिनिमम जब आप लाइंग डाउन लेटे होते हैं तो उसमें होता है, और जो मैक्सिमम होता है वो अगर आप हैवी वेट किसी तरह से ऐसे पोजीशन में उठाएं कि जब जिसमें आपको जिस पोजीशन में आपको नहीं उठाना चाहिए। ये पिक्चर आप देख रहे होंगे एक्सक्यूज मी, इसमें आप देख सकते हैं कि जो सबसे नीचे लेफ्ट साइड पे ऑन एक आप देख रहे होंगे आदमी लेटा हुआ है। ये जो इसमें जो लाइंग प्रेशर है दिस इज रफली अराउंड डिस्कल इंट्रा डिस्कल प्रेशर इज अराउंड 25 kg। However,
इंट्राडिस्कल
if
का
you
अगर मैं थोड़ा यहाँ पे शायद हमारे कुछ नाजरीन ना समझ सके होंगे मतलब ये कि ये जो दो डिस्कों के बीच में जगह है ये इलास्टिक होती है, तो इनके दरमियान जो प्रेशर होता है इसको आप इंट्राडिस्कल प्रेशर बोल रहे हैं।
जी, ये विस्को इलास्टिक मटेरियल होता है डिस्क का, जो कि बहुत ही स्ट्रांग होता है, लेकिन अगर इसमें प्रेशर बढ़ जाए और बहुत ज्यादा बढ़ जाए तो वो प्रोट्यूड अपनी जगह से हिल जाती हैं और वो नर्व रूट पे प्रेस करती हैं। वो आपको शैटिका दे सकती है, टांग में दर्द दे सकती है, और वर्स्ट केस सिनेरियो में अगर वो बड़ी डिस्क हो, सेंट्रल डिस्क, तो क्वाडा इक्वाना होता है। क्वाडा इक्वाना एक ऐसी चीज है जिसमें जो नर्व्स आपकी जो बैक पैसेज को और फ्रंट जो है आपके यूरिनरी स्पिंक्टर्स को जो कंट्रोल करती हैं, वो बिल्कुल जो है वो प्रेस हो जाती हैं। और अगर विद इन
ये
24
सयाटिका, माजरत मैं आपको बीच में डिस्टर्ब कर रहा हूँ, मैं असल में नुमाइंदगी कर रहा हूँ हमारे व्यूअर्स की भी।
जी
सयाटिका शायद इसका थोड़ा मजीद वजाहत की, इसकी अलामतें क्या हैं और क्या ये इरकुन निसा इसी को बोलते हैं?
जी, उर्दू में जिसको अरकुन निसा कहते हैं वही शयाटिका है। बेसिकली यू गेट मोर लेग, आपको टांग में ज्यादा दर्द होती है, और टिपिकली जो टांग में दर्द होती है वो बटक से होती हुई नीचे हील तक जाती है, टांग के पीछे से, फ्रंट से नहीं जाती, पीछे से जाती है। अगर फ्रंट से जाती है तो वो शयाटिका नहीं है, पीछे से दर्द है जो बटक से होके ऑल द वे डाउन टू द हील जाती है। और इट इज वन ऑफ द वेरी कॉमन प्रेजेंटेशन ऑफ डिस्क प्रोलैप्स एज वेल और नर्व रूट इरिटेशन। जी
चले, आप ये डिस्क प्रेशर की बात कर रहे थे, अगर मजीद थोड़ा स्लाइड पे आप थोड़ा हमें समझा दें।
जी, स्लाइड में जैसा कि आप देख रहे हैं लेफ्ट साइड पे कि अगर आप लेटे हुए हैं तो आपका प्रेशर मिनिमम है, अगर आप साइड पे लेटे हुए हैं तो प्रेशर और बढ़ जाता है, आप स्टैंडिंग पोजीशन में थोड़ा और बढ़ जाता है। अगर आप खड़े हैं और आप आगे को झुके हुए हैं, भले आपने वजन नहीं उठाया, तो देन योर प्रेशर फर्दर गोज अप टू 120 और समथिंग। उसके बाद अगर आपने कोई
150।
चीज, जी, अगर आप वजन उठा रहे हैं और आपने गर्दन को झुकाया है ज्यादा आगे की तरफ, तो प्रेशर विल बी वेरी वेरी हाई। जबकि अगर आप वो वजन उठा के और अपनी नीज को बेंड करके उठा रहे हैं और जो हैवी वेट है वो आपकी बॉडी के करीब तरीन है, आप उसको पुल करके अपनी तरफ रख रहे हैं और सीना आपने यूं किया हुआ है, तो देन इंट्राडिस्कल प्रेशर will be much low and you will be at much less risk of injuring your back। कमर दर्द का जो है, कमर पे आपके वजन बहुत कम पड़ेगा उस लिहाज से।
माशाल्लाह, हमारे काफ़ी सारे नाजरीन हमें सलाम कह रहे हैं। वालेकुम अस्सलाम व रहमतुल्लाहि व बरकातुहू। अब्बास आदल भाई हैं, अब्बास अब्दाल, इसी तरह नदीम अशरफी हैं, कासम मोहम्मद है, गुलाम दस्तगीर मिर्ज़ा हैं। अगर आपको कोई सवाल पूछना हो तो लब्बैक, आप जो है वो हमारे कमेंट्स में आप अपना सवाल पेश करें। तो माशाल्लाह डॉक्टर रिजवान वाज टॉकिंग अबाउट बैक पेन, कुछ इसमें अलामात भी बयान हुई। अच्छा, ये बयान फरमाएं कि वजन का जो है वो क्या रोल है बैक पेन के हवाले से? अगर कोई ओवरवेट है तो
जी,
क्या इसका भी जो है वो हमारी बैक पर इफेक्ट पड़ सकता है?
डेफिनेटली इसका इफेक्ट पड़ता है। इफ यू हैव गॉट अ बिग टमी, अगर वजन भी दो तरह से है ना, अगर तो आपकी टमी, अगर आपका एब्डोमिनल फैट बहुत ज्यादा है और प्रोट्रूडेंट है एंड इट इज
जी।
हैंगिंग, देन ऑब्वियसली दैट इज जस्ट लाइक होल्डिंग अ हैवी ऑब्जेक्ट, वजन हर वक्त किसी वक्त उठाए रखना। जबकि अगर आपको जनरलाइज आपकी बॉडी जो है वो मस्कुलर है और आपकी तोंद नहीं बढ़ी हुई, तो देन थिंग्स आर डिफरेंट। दैट इज नॉट एज बैड एज हैविंग अ बिग टमी व्हिच इज एक्चुअली प्रोट्रूबेंट एंड हैंगिंग। बड़ा पेट जो कि लटका हुआ हो, वो जो है वो मतलब रीजन है।
अच्छा, हमारे कामरान भाई जो हैं वो आपका शुक्रिया अदा कर रहे हैं। आप जो है वो अ, वक्त आपने दिया। तो अच्छा, ये तो मैं, ये जो अभी हमारी स्लाइड भी नज़र आ रही है, मैंने इसमें एक ज़रूरी बात पॉइंट आउट की, नज़र आई, तो मैंने कहा नाजरीन से भी शेयर करें कि देखें, अगर हमें खड़ा भी होना हो ना, तो हम कोशिश करें कि बिल्कुल सीधा खड़े हों। तो अगर मिडल में देखा जाए तो उससे हमारी डिस्क पर प्रेशर जो है वो थोड़ा सा कम होगा। चलना भी जो है वो इसी तरह, डॉक्टर रिजवान हमारी मजीद रहनुमाई भी फरमाएंगे कि चलने के दौरान भी अगर कोई झुक कर चलता है या अपनी कमर को जो है वो सीधा नहीं करता, तो इससे भी जाहिर है कि कमर पर जो है वो नुकसान होगा।
जी, आपकी जो रीढ़ की हड्डी है जिसको हम स्पाइन कहते हैं, उसके अराउंड पैरास्पाइनल मसल्स होते हैं, पट्टे, मजबूत पट्टे होते हैं। अब ये पट्टे जो हैं मजबूत तरीन उन लोगों में होते हैं जो रेगुलर स्विमिंग करते हैं या जो एक्सरसाइज करते हैं, रेगुलर एक्सरसाइज, रेगुलर वॉकिंग करते हैं, उनमें उनके ये मसल स्ट्रांग रहते हैं। अगर एक पेशेंट बेड रिडन हो तो वो उन पट्टों में, मसल्स में जो है वो जनरलाइज वेस्टिंग पैदा होनी शुरू हो जाती है। एंड दैट इज ऑब्वियसली वन रीजन। अगर आप देखें बैक पेन के जितने भी किसी भी आप फिजिशियन से जाएं और उनसे डिस्कस करें, द फर्स्ट थिंग दे विल टेल यू इज के नॉट टू रेस्ट। आपने बेड रेस्ट नहीं करना। ऐसा नहीं है कि आप बिल्कुल लेट जाएं और बेड पे, नहीं, इसमें मोबिलाइज एज द पेन अलाउज। जितनी आप एक्टिवली वॉक कर सकें उतना आपके लिए बेहतर है।
चले, माशाल्लाह, बहुत शुक्रिया। हमारे कामरान भाई ने सवाल किया है कि कंप्यूटर पर बैठने के हवाले से, इंशाल्लाह वी विल डिस्कस दैट। वी गॉट सम स्लाइड्स एज वेल। And now the question I would like to ask Dr. Rizwan at the moment is that so someone develops back pain, what should they do? What should be the next steps? Because people have got different mentality, they've got different sort of, they either would try to ignore the problem, or they will try to use number of different remedies. What is the sort of medical opinion on what one should do when they start developing back pain?
There are a few things which we need to consider. The first important thing is whether the back pain is on its own or whether you have got something else along with the back pain, i.e. what I meant is leg pain. अगर बैक पेन के साथ लेग पेन है, that is a slightly different scenario. And the most important one is the one which I wanted to mention, which I've been mentioning a few times, is a quad equina. Basically उसमें होता ये है कि बैक पेन के साथ ये होता है कि आपका अपना पेशाब पे कंट्रोल नहीं रहता. You either go into urinary retention or you wet yourself. So that is very, very important, and that is an emergency. That is a real emergency. ठीक है. और उसके साथ दूसरी चीज ये होती है कि बैक पैसेज पे पखाने का कंट्रोल नहीं रहता है. Patient can't you know have control. They can't control their feces. They soil themselves. And the third important thing is, which the patient can find himself, is when he's wiping or cleaning or washing the bottom. उनको जो बैक पैसेज का जो पीछे का एरिया है वो वाला जहाँ वो स्पिंक्टेरिक एरिया है वो नम नजर आएगा. वो जैसे अब कई दफा होता है कि आप काफी देर बैठे रहें तो वो ऐसा लगता है जैसे वो सुन्न हो गया, तो वो बिल्कुल ही सुन्न. वो जब वाइप करेंगे तो वो फील नहीं होगा. ये these are called red flags signs. अगर ये signs हो, you need to attend accident and emergency department straight away. सीधा बिल्कुल जाएं. Don't waste the time. Don't waste time in taking just the painkillers and leaving it until the following day. It is one of the surgical emergencies. It has to be dealt there and then ASAP, within 24 to 48 hours. Otherwise, you miss the boat, and for the rest of your life, you won't have control on your urine, and unfortunately, you may not have control on your feces as well. आपको सारी उम्र के लिए nappy पहनने पड़ जाएंगे. Unfortunately, this has happened. और one of the negligence, medical negligence में ये बहुत common तो नहीं, लेकिन ये one of the commonest. इसमें patient जो है they have actually sued the trusts up to £500,000 to £1 million. तो ये मैं
Now,
जो
this
red
is
flag sign.
really very
जी.
sad. One thing is obviously negligence from the medical profession. That obviously is never intentional, but most importantly is the negligence
Yes.
on behalf of the patient or their obviously family members. And sometimes they just get lazy and they try to ignore it, and then the problem gets worse. And that, I think, goes with the many of our obviously other medical problems. Always try not to ignore your medical problems. Go and speak to your doctor, consult with your doctor. And alhamdulillah, here in UK, health services are free. Now obviously we're in lockdown time, where clearly the doctors are not seeing you face to face, but in this lockdown especially, people are thinking that they can't call their doctor, and this was an issue which was discussed in the media, that many people are having angina symptoms or other major problems. They're not contacting the doctors, they're not going into hospitals, and few deaths have happened from that point of view. So the point here is, they always seek the advice of the doctors. So the doctors will obviously will investigate, and they will diagnose and treat the problem. Our focus of the program is prevention, primary prevention, what the patients can do, what the people can do to help themselves not to develop the back pain. Now obviously I'm trying to summarize Dr. Rizwan's discussion as well, because some of the viewers may be joining us later on. That the important thing is that we need to look after our back. Dr. Rizwan talked about having a good posture whilst standing, whilst walking, whilst sitting, whilst driving, whilst sleeping. And also, very importantly, Dr. Rizwan mentioned about having a good weight control, especially if your tummy is protruding. And you've got a lot of abdominal fat. That obviously imbalances your posture, and your muscles have to work extra hard to keep your back straight, which can then obviously cause back pain problems. Now, let's move to our second segment of this program. Really, is how we can actually help ourselves not to develop back pain problem. Now, I would like to take Dr. Rizwan in a sort of a guided way, because we've got some slides as well. So the next slide that I have is about our sitting posture. So whether we are sitting on the chair or whether we are sitting on the sofa. So Dr. Rizwan, if you could guide us a little bit on sitting posture, how that can help our back.
So as you can see in this picture, there are few things which can be done if you are involved in a job which involves sitting longer for longer time period. You should preferably have a chair with the arms. दो arms वाली chair आपके पास हो, आपकी back, you need to keep your back all the way to the bottom rather than sitting in an awkward position. You need to be in a comfortable position. And the third thing, as you can see from the same picture, um, your both your feet should be resting on the floor. They shouldn't be off the floor. So your chair shouldn't be way too high or way too low. So it has to be at a comfortable level for you if you're involved in a long sitting where where you will be sitting for a longer time period. That's the first picture. Now if you move to the next one, which is if you're
Give me
involved.
1 second. I will. So this is our Kamran by asked the question, and that was about computers.
Yeah, so this is the picture. As you can see clearly, the level of your screen has to be around the level of your face, your head. Your neck should be straight, and you should ideally again have preferably a chair with the arms, or if not, then the level of your arms should be resting um, on the mouse or the keyboard. So एक comfortable level होना चाहिए. इसमें ऐसा नहीं है कि आप सर उठा के देख रहे हैं, सर नीचे करके देख रहे हैं. It has to be at the level of your eyes. So these are few basic things.
I think, I mean, one thing I would like to emphasize in this image is that look where your eyes should be pointing on the piece on the screen. That's
Yeah.
one thing, and the other thing is obviously where your neck should be, how your neck should be, not leaning forward, but in the direct sort of line of your backbone, and also very important about your wrists. So, Dr. Rizwan, I would like you to particularly mention carpal tunnel syndrome. What is it and how can it develop?
So if your wrist is too much flexed or too much bent, like so, that's a straight wrist. If it is in a constant position like this or that way, the pressure in the carpal tunnel increases. And if the carpal tunnel pressure increases and it stays
What is
increased
carpal
for
tunnel?
carpal tunnel is basically the median nerve which goes in a tight canal along with nine other tendons. And there's a very limited space. And if the position of the wrist is in a bit awkward, then the pressure in the tunnel will increase. It will be a bit too crowded because of the positioning. It will be in a position where the pressure on the nerve will go up. And what you will get is pins and needles or tingling in them three fingers, which usually gets worse at night. And sometimes you have to shake the fingers like this to leave that tingling or numbness. So that is something which, yes, you can get if you are using a mouse and a keyboard, which is not in an appropriate position.
And when you are sitting to use a computer, what about the feet? Should they be touching the ground? Should what sort of position should they be in?
Yes, as I mentioned earlier, they should be comfortable on the floor, or if they are way too high, then you can use some sort of support where you can have your feet rested on.
Okay, let's move on to the next position, which is very important, and that is driving.
Yeah.
So we got a picture here. So Dr. Rizwan, could you kindly take us through this image and what should be our posture during driving?
Yes, I mean the picture is self-explanatory, as you can see. Your back should be right at to the seat. Your headset positioning should be comfortable. You need to adjust your seat that you don't have to lean forward or your foot is too much bent or flexed when you're applying the brakes. And the other important thing is that with regards to the arms, you should ideally not hold the steering too tight. It should be in a comfortable position. Otherwise, the patient can or people can get another syndrome, which is called a cubital tunnel syndrome, whereby if your arm is in a different position for a longer time period, the nerve around your elbow, around your this funny bone, can get stretched and can get a transient, not paralysis, but paresis, I would say, that can transiently defunction. So the position should be
What is
comfortable, as you can
transient?
see. Sorry.
What is transient? What is transiently defunction? You are using
Transient
a
means
lot
ke, transients mean it
of
will recover. It will recover on its own. It's not a major.
सही
Um,
मतलब
yes,
short term.
yeah, short term, usually short terms, or if you keep it on a longer time period, it can be for a good few days as well. लेकिन इसमें जो इम्पोर्टेंट चीज है वो ये कि पोस्चर है इसमें भी. अगर आप ड्राइविंग कर रहे हैं तो आपका पोस्चर यूं नहीं होना चाहिए. ऐसा नहीं कि आप क्या उसको कहते हैं, वो डड्डू बन के कार चलाने की बजाय आपकी पोजीशनिंग प्रॉपर होनी चाहिए. your both the hands should be on the steering, as you know, मतलब जैसा कि इनकी एडवाइस भी है. और कंफर्टेबल पोजीशनिंग होनी चाहिए, प्रॉपरली फीट भी आपके लगे हों और आपका हेड जो है वो पीछे कंफर्टेबल हो, बिल्कुल यूं करके नहीं होगा कि एक तरफ फ्लेक्स नहीं हुआ हो.
I think what is a common mistake that we do is clearly in this picture, you can see the headrest. The round thing on the top is the head of the driver, and there is a headrest of the car seat. I think majority of us don't actually make effective use of the headrest. And
Yeah,
if our head is not resting against the headrest, then what could it actually cause problems in the neck muscles?
of course it will cause problem in your cervical spine. So you can get hit from both the sides, from to your cervical spine and to your lumbar spine. तो प्रॉब्लम ऊपर भी हो सकता है, नीचे वाले स्पाइन में भी हो सकता है.
Sahi. Chale, it's let's move on to the next image. We've discussed with the obviously the pressures within the body. Now, the next image that I have is in terms of lifting. Now, before I obviously ask Dr. Rizwan to explain this further to those viewers of our social media who may have just joined, we are talking about back pain. Back pain is our topic today, and we are talking about preventative measures. So in the preventative measures, we discussed, Dr. Rizwan, mashallah, very beautifully enlightened us on our posture, our standing position, our lying down position, our sitting position. When we are using the computer, what our position should be. You can watch this program from the beginning after the live feed finishes. And also the last slide we discussed about our posture when we are driving, because these are the things which I mean, Dr. Rizwan in the beginning said that the biggest cause of back pain is musculoskeletal problems. So the muscles and the bones. And what happens is if our posture is not right, then on the lower spine, or what we call as lumbosacral spine, it actually produces a lot more pressure. It's a bit like levers. You might have seen those levers when you have a long, when you the longer the distance is from the center, and the more pressure that you apply, then obviously at the center there is much more increased pressure. So in the same way, this slide will also actually help us better that in terms of lifting. So previously we've discussed about sitting, standing, lying, posture when we are using computers, posture when we are driving. Now obviously we always lift things. Now it doesn't have to be heavy things. Any small, like picking up a pen from the surface, picking up a glass of water from the floor, all of these act as weights. So, Dr. Rizwan, if you could actually take us through this slide of weightlifting techniques and how they can cause problems, poor weightlifting techniques, how that can cause problem for our back.
So if you see this, the picture on the image, the one on your very left side, yes, the first one on the left side is the worst position. इसमें आप देख सकते हैं कि you bend your back forward, you haven't bend your knees, and you're lifting a weight in a very awkward position, and this is where the things can certainly go wrong. And the worst thing is कि अगर आप इस तरह lift कर रहे हैं and then you do a sudden twist, अगर आपने थोड़ा सा भी इसमें rotate किया body को, तो then that is even worse than what it is showing in this picture, the one on the first one. Then if you move to the last picture, that is not good either, because उसमें ठीक है, you have bent the knees, but the weight is far away from the center of your body. So the picture actually in between is better, in the sense that you have bent your knees and your facing forward. आप आगे को झुके नहीं हुए, अपने बॉडी को झुकाया नहीं हुआ, आपने अपनी बॉडी को बिल्कुल सीधा करके रखा हुआ है, आपने बेंड किया, आपने वजन को उठाया, and you have pulled it towards as close to your body as you can. That is the safest way in terms of lifting anything heavy.
चलें ठीक है. So that's one thing is very important from my point of view to add is that we do a lot of bad posture, bad lifting techniques automatically without paying any attention. What is very important is that we have to analyze our positions when we are sitting, driving, when we are picking things up, and make sure that we bend our knees and keep our back straight. This is something that we will have to develop the habit consciously by making an effort. Okay. Our Asif Matloob Bhai, mashallah, he's actively involved in our Leicester Fazan Medina Facebook page, and a lot of technical stuff. Mashallah, his role is very important in this. So he's asking a question that please explain if while playing sports, if we develop a pain in the calf or other muscles, so like a immediate sports injury, what should we do and how long is the rest required?
So these are the racket sports. Badminton is a racket sport. His question is pain in the calf, and then he has mentioned pain in the back as well. So these are slightly two different things. If there is a pain in the calf, then one should really be worried about the tendoachilles, the Achilles tendon, that can get ruptured as well in racket sports. The second thing is the back pain. Now, if this back pain is along with the calf pain, then that means it's most probably sciatica. And again, having said that, you won't see a 70 or it's very unlikely कि एक 70-80 ओल्ड का जो बुजुर्ग हैं वो बैडमिंटन खेलें. इट्स अ स्पोर्ट्स ऑफ द यंगस्टर्स. तो यंगस्टर्स में जो है, अगेन एज आई सेड, इट्स अ मस्कुलोस्केलेटल, नथिंग नीड्स टू बी वरीड अबाउट. But occasionally they can get a disc prolapse as well, very very occasionally. उसमें भी bending और rotation, अगर ये दोनों bend, spine flex हो, bend किया हो और rotational हो, rotation हो spine की, तो that is the worst combination. तो
But I
उसमें
think
जाहिर है रेस्ट करें अब. जी.
what you are trying to say is that most likely this may be muscle pull, but also it could be serious as well, because this is where people may think, oh, I've just pulled a muscle. Either I'll use deep heat for a while or I'll rest it for a couple of weeks. But the important thing is this could be, as you said, if it's a rotational, that the back was rotated as well, then you do need to, obviously, I think the best thing will be to go and speak to your doctor before you self-diagnose that this is just a muscle pull. Now, Jazakallah khair, we've obviously come to the end of our silsila. We just got one more slide. Dr. Rizwan, if you would like to actually mention anything, I think this may be a summary of what we've discussed so far. Is that correct?
Yeah, this is a summary of something which we have already discussed. There are a couple of things I would quickly want to mention because I think they are very, very important and relevant. The first thing is the people who are smoker. They are, again, like you mentioned about the high BMI or obese people. People who are smoker, they are at much more higher risk of getting a disc degenerative disease. उनकी रीढ़ की हड्डी के मोरे जल्दी हिल जाते हैं. This is something very, very important. The other two things which I should not forget to mention, and I think people should be aware, is infection and tumors. So if the patient is younger than 14, 15 or elder than 50, there are two things which you shouldn't forget. One is infection and one is tumor. अगर छोटे बच्चे में बैक पेन है और बुखार है तो that is something very serious. अगर बच्चा बैक पेन की बात कर रहा है, उसको साथ बुखार भी है, उसको आप जरूर लेके जाएं डॉक्टर के पास. Make sure you make all the efforts to take him to the GP or hospital. Or अगर patient 50 plus है and there is a history of back pain which is not lower and it's probably a bit more upper, back pain के साथ साथ weight loss, sweating, ये history है, it is very very important. क्योंकि वो ट्यूमर भी हो सकता है, जो कि मैंने बहुत सारी इंसिडेंटल फाइंडिंग यहाँ पे देखी कि ट्यूमर्स होते हैं और इन्फेक्शन भी हो सकती है, पर्टिकुलरली इफ समवन इज अ आईवीडीयू, इंट्रावीनस ड्रग यूजर. जो लोग नशा करते हैं उसमें तो इसके चांसेस बहुत ज्यादा हैं, और अगर आप उसको वेल इन टाइम पिक नहीं करें तो आप पेशेंट पैरालाइज हो सकता है.
चलें डॉक्टर रिजवान, बहुत शुक्रिया. इंशाल्लाह हमारा आपके साथ फाइनल सेशन होगा फ्राइडे को. मैं आपका बहुत मशकूर हूँ. आई एम वेरी ग्रेटफुल टू यू दैट यू आर टेकिंग दिस टाइम आउट एंड गिविंग अस योर expert opinion and very valuable opinion. May Allah Azza wa Jal give you the benefit of this. There is a hadith of the Prophet sallallahu ta'ala alayhi wa sallam, khairun nasi man yanfa'un nas, that the best among those is the best amongst people is the one who benefits others. So alhamdulillah Azza wa Jal, Dr. Rizwan, may Allah Azza wa Jal, give you the benefit and the blessings of this Hadith Mubarakah. On Friday, we will be talking about knee pain. That's another very common problem. And inshallah Azza wa Jal, on Friday, around 20 to 5, we will be live again with Dr. Rizwan. And then inshallah after that, we've got many more other sessions with other doctors, inshallah Azza wa Jal, planned, where we'll be talking about issues, topics like diabetes, blood pressure, cholesterol issues, heart problems, and so forth. And the problems that affect our Asian people most of all. So there's plenty more in the lineup. Today we were our Asif Bhai now will be live for his Tajweed class, so I don't want to take too much of his time. So please do join Asif Bhai as well. He is, mashallah, just ready to go. I would like to add him to our page here. Then, inshallah, he will obviously go live from his page. Thank you very much, Asif Bhai. He is always in the background and doing things. If the internet connection goes and so forth, then he takes charge. Anyway, thank you very much for joining, Dr. Rizwan. Jazakallah khair. Thank you very much to all the viewers. Inshallah, we'll be back again on Friday. Sallu ala Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wa sallam.